If you suffer from sciatica, you may have been told that you should walk as much as possible. But what do you do if walking is the thing that causes your sciatica pain in the first place? I find that's especially common in people over 50 who have sciatica. And so in this video, I'll share 7 tips to help you walk more comfortably. The first tip to relieve sciatica when walking is taking shorter steps. When you take really long steps, that pulls your spine into extension, especially if you have stiff hip flexors. And when your spine gets pulled into extension, that narrows the spaces or foramen where the nerve roots that make up your sciatic nerve exit your spine. Instead, by taking shorter steps, you can keep your spine in more of a neutral position rather than hyperextending it when you take larger steps. And that brings us on to the second tip, which is keeping your core tight and even leaning forwards just a little bit. When you keep your core tight and lean forward, it allows you to take a larger step length without pulling your spine into hyperextension. So combining the first 2 tips, taking slightly smaller steps and leaning forwards, that helps you to keep your spine in more of a neutral position while you're walking, which should decrease your sciatica pain. The third tip is to push rather than pulling. Many people will pull forwards using the heel of their front leg, but that puts your sciatic nerve on tension across your hip and on an extended leg, and then uses your hamstrings, which run right over top of the sciatic nerve, to pull you forward while that nerve is on tension. Conversely, when you think about pushing off your back leg using the glutes and the toes or the calves, when you push off, that encourages you to get more hip extension rather than going into spinal extension. Combining tips 1, 2, and 3, taking shorter steps, pushing off the back leg, and leaning slightly forward while keeping your abdominals tight, that helps you to keep your spine in more of a neutral position once again. Now the next tip is in the side-to-side plane. This one is particularly helpful if you have sciatica only affecting one leg. If you put the arm on the painful side over your head, that helps offload your spine on that side a little bit. It stretches a muscle called your quadratus lumborum, which runs between your 12th rib and the top of the pelvis. When that's stiff and tight, it can compress the nerve roots on that side. When you put your arm up like this while you're walking, it also encourages you to lean your spine just a little bit away from the painful side, which also opens up the spaces or foramen where the nerve roots come out. Along the same lines, you can also use a cane in the hand opposite of your sciatica. Much like raising your arm up encourages you to lean slightly away, when you lean on a cane on the opposite side, it allows you to offload this leg. It also allows you to side bend your spine slightly towards that side, opening up the nerve roots on this side while you're walking. When you're walking with a cane, you want to move the cane and the painful leg at the same time, or even having the cane hit the ground slightly before. You do want to put some pressure through this arm. So you're not just kind of tapping like this or using it for balance. You're actually taking some weight through that arm, which offloads this leg. If even walking with a cane is painful, you can also walk using a wheeled walker. When you use a wheeled walker, it allows you to lean forwards on it slightly, which opens up the spaces where the nerve roots come out of your spine, and it allows you to unload your body weight to a greater extent than when you're using a cane. So it allows you to lean forwards. It also gives you a traction or decompression effect by pushing up using your arms. Now, many people don't want to use a wheeled walker, but even if you're not going to use it all the time, using it for short periods, such as when you're going out for exercise, can allow you to walk for longer periods of time, which gets more oxygen to your nerves and ultimately helps you to walk longer without the walker in the long term. Now, similarly to that, you can also do other forms of exercise, such as exercising in the water. When you exercise in the water, the buoyancy effect of the water acts similarly to the walker and helps offload your spine. Or if you don't have access to a pool, you can also use other seated forms of exercise, such as recumbent bikes, seated steppers, or seated ellipticals. So hopefully you found that helpful. If you did, you can find loads more tips to relieve sciatica in my new book, The Over 50 Sciatica Solution, Get Relief Naturally Without Pills or Surgery. It's a 214-page book divided into 3 parts. Part 1 will help you better understand sciatica, specifically as it relates to people over 50. Part 2 is a self-assessment, very similar to the framework that I use when evaluating a patient in the clinic, but in a do-it-yourself at home version. Now, this isn't a substitute for seeing a healthcare provider, but it does give you some amazing insights and can help you better communicate with your healthcare provider. And then part 3 are all the different tips you can use to relieve sciatica. And not just exercises, there are tips to help you move more comfortably during everyday activities, to eat better to fuel your nervous system for recovery, to sleep better, and to manage stress better, all of which are crucial to recovering from sciatica. You can buy the paperback version on Amazon, but if you're more concerned about what's inside, rather than having some pieces of paper to hold in your hand, I do have a special digital bundle that you can get at over50sciaticasolution.com. When you buy the ebook version for just $4.99, I'll include the audiobook version absolutely free. I'll also include a bunch of other free bonuses, including the morning relief stretch routine, the sciatica symptom tracker, and the pain-free standing and walking guide. You can learn more about the book as well as the bonuses at over50sciaticasolution.com. Thanks for watching, and I'll see you in the next video.